who's a band that I've been following since like college. We've seen them live several times, and we got to see them last in. I can maybe play. They might copyright. Um, we saw them. This is actually a recording from when they played with the Omaha Symphony, and the songs are so good. My favorite song is "Come Downstairs and Say Hello," which is just so amazing. Um, but if you are looking for music, check out Guster, Guster. Their concert that we got to see at the Omaha Symphony is called Omega, Omagah exclamation point. So if you put that in, you'll get to find them. And we're going to answer some questions today, and I realize that I have to grab my phone. If you have a question, text me 402-256-0768. It's right there on this. That's where you can text me to get your question answered. People always ask me, what's all the crap behind me? This is kosher salt from my lunch. And then these are some chocolate bars because it's election day and you're not supposed to drink wine at work. So actually, we don't really drink wine. We don't really drink much anyway. Sometimes we do drink wine. But yeah, that's why the chocolate is there, is because it's election day. I won't eat those two whole bars, I promise. But we're going to answer some questions. I have patients arriving, let's see, and so they'll be ready in probably 7 or 8 minutes. So until then, I'll answer questions, and then we'll pick up where we left off when I can do it again. And I can see my glasses are like really dirty. I even washed them today. And I don't know, probably Gloria grabbed them or something, but that is just driving me crazy right there. It looks terrible. Okay. Okay, good first question. Dr. B, wonder if you could talk about your thoughts on circumcision. Thanks. Great question. And this will get lots of play because it's like something that's really controversial that people want to talk about and learn about a lot. And so I will talk about it. I don't know if I will be able to keep the comments on for long. So if you have a comment, ask quickly because sometimes vaccines and circumcision get a lot of comments. I am one that does not push circumcisions. The vast majority of patients, actually 99.87%, have already decided long before we've met, long before I see them in the hospital, if they want a circumcision or not. And so I very rarely am even asked my opinion on it. And when I'm asked my opinion, I say, it's up to you guys. And I really leave it in the ball in their court. Because it is not something that is medically necessary. It is not something that is hygienically necessary. It is something that has a lot of social, religious, family context around it. And I typically rely on the parents to decide this is something that's important to us, this is something that was important to our parents and our ancestors and blah, 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 or this is not and it seems ridiculous and we're not going to do that. And then I just say, okay, that's fine. To either. It's a religious, it's a social, it's a historical family history sort of decision. And I respect and honor whatever the parents decide. I don't push either do it or don't do it. If parents want it done, I do circumcisions and I will do that for them. If they don't, I don't do it, and we don't like document it or anything like that. We don't treat them any differently, obviously. But it's just totally something that's in the parents' wheelhouse, and they make that decision. And I will often say, if you're not 100% sure, let's wait, because it's not an emergency thing. Like, we can do it when they're a week old, when they're 2 weeks old. If you guys aren't sure yet, like maybe you didn't know it was a boy, or this has just really been something that, you were stressed with having a baby and didn't really consider it, let's just wait. We'll figure it out when you're good and ready. And even if you wait 6 months, well, I'm not going to do it then because babies are too big and squirmy and everything like that. But urologist can do it under anesthesia at that age. Or you can wait until he's, able to make that decision for himself. I'm totally fine with that too. So I don't push it on people. I don't try and talk people into it or out of it. I am very, you do you, and I will support you in that decision. The medical reasons for doing a circumcision, they're really, there's a slight reduction in urinary tract infections in the first year of life. But urinary tract infections in boys are quite rare as it is. And so alone, I don't think that is a compelling argument. Unless a boy has 3 urinary tract infections in the first year of life, then we might say, okay, this might be medically wise because urinary tract infections can cause kidney damage and all this other stuff. That might be a reason to circumcise. Penile cancer, again, very rare and not something that makes it so legitimately necessary to do that. There is a risk of STD transmission. HIV in particular is one that we talk about. Now, in the developed world that has great access to healthcare and everything like that, the argument is not so compelling to say everybody should get circumcised to prevent the transmission of HIV. In other parts of the world, that isn't always the case, and some places do recommend it on a more routine basis for STD prevention. I can't speak to anything more on that because I'm just ignorant of the specifics. And so that's my thoughts on circumcision. Do it, don't do it. I don't care. Hope that makes sense. Okay. No patients are ready yet, so I'll keep going. Our 17-month-old has started throwing tantrums sometimes when we put him in his high chair for meals and refusing to eat, or if we don't give him more of what he really likes, like fruit, before he eats other food. Not sure how to handle it. Ignore him, take him out, and help him try and calm down. Try again later. He is normally a good eater, but it seems like this is becoming a power struggle. This is the most common power struggle in the 12 to 24-month-olds is eating. Most people have sleeping figured out by then. And if you don't, I have a sleep training course called Mighty Sleepers. If you go to mightysleepers.com, you can get it. And if you put in the coupon code 2020, it's 20% off because 2020 has just been a cluster and I want to give back a little bit. And so mightysleepers.com. If you already have sleep figured out, the next big issue is feeding. And that's what often comes up is they're throwing their food on the floor. What do we do? He loves chicken nuggets. He loves peanut butter and jelly. He loves hot dogs. He loves cheese pizza. We all love those things. And if we could eat those things all day, then we would turn out like, a lot of Americans, like really overweight and sedentary lifestyle and early coronary artery disease. We want to have our kids eat healthier typically than us. We want our kids to have a robust diet and willingness to try new foods and all those things. Daniel Tiger tries to convince us to try new foods because they might taste good. And we want to actually see the results of, all of this Daniel Tiger watching that we're doing. And so for me, kids are growing fine. Unless you have a specific issue that your pediatrician has said, you got to feed this kid whatever it takes because he's failure to thrive, which is less than 1%, very much less than 1%. I can think of one child per year, which is way less than 1% in my practice, that I was really worried about their growth from a weight perspective. And my patients that are watching this know exactly who they are. But for the vast majority of kids, it's totally normal to be picky and to have food preferences and to push the buttons and power plays on, I don't want to eat this. I'm going to throw it on the floor. I'm going to throw it to the dog. I'm going to throw my plate. I'm going to push it over. I mean, throwing is a really common strategy in our house, if you can tell. Or I'm going to say no, and then my parents are going to feel bad and what do I do because he didn't eat his dinner, and can I put him to bed without food, and what's going to happen? The simplest way of all of avoiding picky eaters, and I have hundreds, thousands of patients, and I can think of very, very, very few that are picky eaters that I've had since they were born, because I tell parents the same thing at 15 months. When he throws the food on the ground, you move his plate back. You say, oh, it looks like you're done. And then when he tells you in his way, I'm hungry, you give him that literally exact same plate. We have these plates at our house that the kids are very specific about the color of the plate they have. I don't know how we got into this. Green, blue, pink. We only have 3 colors, so 2 kids. Actually, our most chill kid just gets whatever color she gets because she doesn't care. Everyone else has their specific color. If he sees, hey, this food looks exactly like the food that I was served earlier when I said no, eventually he'll get to the point where he's like, this is the same blue plate that I was eating off of earlier when I threw it on the ground or when I refused. It looks like they're just going to keep being more stubborn than me. I might as well just eat. And then they do, and it works amazingly. And you just have to be more stubborn and persistent than them. If they refuse to eat their dinner, you cover it up, you put it in the fridge. They tell you, I'm hungry. You get the food out. You can warm it up if you choose. Give it back to them. That is all you need to do. They will regulate themselves if they choose to eat or not. You don't have to get into wars and fighting and peanut butter and jelly and mac and cheese and chicken nuggets and all of those things. Like if everybody's having chicken nuggets, it's fine to give your kids chicken nuggets or mac and cheese or whatever it is. But if you're making lasagna or beef stroganoff or quinoa or whatever it is, feed your kids the foods that you're eating. Set a good example. Be a model of trying new foods because they might taste good. They will follow suit. But it doesn't mean they'll do it every time. They will sometimes throw their food on the ground. That is normal. It's how you react rather than how the child is. You can raise an unpicky eater if you have the right mindset and do the right thing, which is just don't give in to he hates this food. I'm just going to make him peanut butter and jelly. Blah, 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 blah. Don't do that. That's how to do it. But it is a power struggle for sure. Okay. Next question. Okay, I have time for one more question and then we'll keep going. Oh, that's the exact same question. How do you get a 7-year-old to eat more types of foods? He is small for his age and will hold out for his favorite foods. So we feel like his small is giving him something we know he will eat. It is fine to have like preferred foods. And I think, so this question is a little bit different because it's a 7-year-old. You can certainly reason with a 7-year-old. You can have rational discussion with a 7-year-old. And so what I would do is make sure that he has a small amount of foods that he prefers on his plate. And you can say, wow, you did a really good job. Hey, if you'd like more raspberries, I'd like you to eat 3 bites of green beans. Oh my gosh, you ate 3 bites of green beans. Would you like another raspberry? Because you love raspberries, don't you? And you can gradually work them up that way. If you use positive language, if you're affirming, if you congratulate them when they do a little bit better than last time, that is how you slowly improve what they eat. If you want to hold out and, if he's small for his age, everyone's like, well, I got to feed him whatever it takes to fatten him up. Instead of like giving him those foods, you can just try and inject more calories into his other food. Not literally inject, but whole milk, peanut butter, olive oil. Like just don't skimp on those things when you're feeding, and that will be calories that they can take in and grow from. Pairing foods they like with new foods is a great way to introduce new things. Okay, my patients haven't been marked ready yet, so I'm going to do one more question. Oh, this is the exact same question. Man, it was a day of kids throwing food on the floor. Dr. B, any tips on how to teach an 18-month-old not to throw his food on the floor? We have 2 dogs. Yes, we have a dog too. And Monty eats more people food, more Gloria food than anything else. And our kids all just like yell at Monty to get down all the time. And I sit next to Gloria. So I'm always trying to like not kick him. I don't kick Monty. But I certainly do, put my foot in his general direction gently. I don't even touch him because he's pretty quick to move, but to try and get him to get away from Gloria because he loves to eat her food. But no more advice than I've already given on this. This is all the exact same stuff. Okay, let me click refresh because I don't want to make my patients wait, but nobody's ready yet. So we'll keep going. I can't even remember which one I'm on. Hey, Dr. Boucher, what do you think about a mom traveling to Texas in the next couple of weeks for a family wedding? I have a 3-month-old at home, but I was going to leave her with Dad for the weekend to try and prevent them from possibly being exposed at all. Is it worth the risk since I could bring something back with me? Also, not only worried about COVID, but no RSV season is coming. So worried about that as well. Yes. So traveling at this moment, it kind of depends what the delta is between where you are and where you're going. Here, if you're in Nebraska, like we're in terrible shape right now. And so traveling somewhere else probably isn't that risky. Texas is pretty bad too. I mean, it's kind of the central Midwest, upper Midwest, lower Midwest where cases are really high right now. But I do think that you need a balance, like, do I have to go to this wedding? Now, you might have to go to the wedding if you're the best man, or in your case, it sounds like you're a mom. So, matron of honor or bridesmaid or whatever, what have you. It depends on how close of and important it is to you. I think that there is a reason to go to these special events, and it kind of depends on what the event is going to be like. Are they going to wear masks? Are they going to social distance? Or is this kind of just a free-for-all that we're walking into? In which case, I would be very reluctant to go and pick something up yourself and possibly expose. Now, things that you can do at the wedding, if you decide, yes, this is important to me, yes, I need to go, wear a mask, social distance, be present for the things you need to be present for, and then step away and say, I got to call home or something like that. Ghost your way out. Like, weddings are busy unless you're somebody has to give a speech or something, most people honestly don't notice if you're not there for a little bit of time. And I probably sound like a grouch with the way that I'm talking. But that would be my advice. I would be reluctant to go in general. I would look at the case counts and how things are transpiring. I would wear a mask and socially distance if you go. But then I think it's just a matter of risk benefit ratio and really talking that through with your spouse and deciding whether or not it's worth it. It's worth it for some people to go to weddings. It's not worth it for everybody to go to weddings. There's a balance, and you got to find that. And that's all. Like Forrest Gump says, that's all I have to say about that. But I will have a video in the coming days on Thanksgiving because I'm getting loads and loads of questions. I can even see some questions right now as I'm talking, which, by the way, if you have a question or if you just want to know when I'm going to go live, I usually send out a message in advance when I'm going to go live. It's 402-256-0768. You can text me, and then I'll let you know when I'm going to go live. Oops, dropped it right on my keyboard. I don't remember what I was going to say. I will have a video on Thanksgiving coming out in the next couple of days because a lot of people have been asking, because I think it's really important. We'll get through this election and then talk about Thanksgiving after that. Have a good day. Keep up the good work. And please, if you're on YouTube, subscribe. If you're on Facebook, hit share. Keep up the good work.